want to introduce you to the video you are about to see. It's a short video. This healthcare fellowship, the backdrop of it is I sit as a part of the Newark Beth Israel Community Board. And for the past 2, maybe 3 years, we've been having different conversations about how we're going to address issues of the social determinants of health. And how are we going to create communities where sickness is not the main focus, but rather health and well-being. And in those conversations, and those conversations get lively, they're very robust, and they're very thoughtful, there's been a need to consider pipeline issues. How do we deal with the root causes of illnesses? How do we create a cadre of people who can respond to those root causes? How can we get systematic response rather than the kind of disease model that has really perpetuated health and healthcare over the past couple of years? And so this project is really born out of a series of conversations over those periods that says that we know that the people who carry the burden of illness in our society are women and girls, and they're primarily women and girls of color. And while we have a lot of programs, issues, incentives, policies directed to externalizing health issues, right, gun violence, etc., it's right in here. There's not been as much attention paid on how internalizing issues end up manifesting themselves in chronic diseases. And simultaneously, we know that we have a healthcare industry that does not know how to deal with, interact with, or support people of color. And so the question is, do we just continue on the course that we've been on, or are there things that we can do to strategically interrupt it? And one of the strategic response is this healthcare fellowship. Do you see it? Aaron, do you?
No, I don't.
Yeah, looking for it to acknowledge.
I don't even see it up there. I can I could put it on a thumb drive.
That would be most helpful.
Do you have one?
No.
Should I give you one?
Yes, please.
Oh. It's in the side of my bag, the first little pocket. So a part of this, the actual outside, the first pocket. So a part of this is a strategic response to interrupting health inequality and creating greater health equity. And I want to say those two things, right? So health inequality and health equity are not interchangeable, right? So we have been focused a lot on equality because we know that people of certain groups or population actually need the same resources. But health equity is something else. Equity is about making sure that people get what they need, which may be different. In some cases, it may be more. In some cases, it may be less in order for us to have a kind of commensurate health and healthy society. And so one of our work at the GrassROOTS Community Foundation is to help organizations think about and reimagine how they interface, particularly with populations of color, but more specifically with women and girls. And so this healthcare fellowship has an opportunity to introduce girls really early in the process to recognize that healthcare systems and healthcare can be an option for them. And not necessarily an option in the way that we often imagine it, that everybody will become a doctor or a nurse, right, and be at the front lines. In fact, healthcare, all of the research says over the next 2 decades, healthcare is going to be the #1 employer. And so we need to reimagine how that looks. So there will be people who are architects, there will be people who are artists, there will be digital people in technology, et cetera, all of whom are part of the healthcare system. And so we want to do 2 things with this fellowship. One, we want to expose girls to this new field, this robust field where they can earn a lot, they can also do social good. But secondly, we want to have healthcare workers, those who are on the front line, who actually really understand the issues that are facing women and girls. And so this is the first kind of entree to that, starting the pipeline really early, and making sure we better understand how it's flowing and where there's stymies and things are not happening. And so we're really thankful to RWJBarnabas for deciding to invest its time, money, and resources to make this possible and to take this vision and make it real. So the video will highlight some of what the girls themselves have learned through the process.
This summer, the girls in the LEAP cohort were given the opportunity to learn what it is like to work in a healthcare system as GrassROOTS partnered with RWJBarnabas Health. Not only did we get to learn that there are different jobs in the healthcare system other than doctors and nurses, but there are also lawyers and pharmaceutical technicians. But we also got to learn that women of color and women in general do have important jobs in healthcare systems.
So when we're always using the hashtag #InvestInGirls, RWJBarnabas showed up and said, we really invest in girls.
We came together with a bunch of other women leaders who volunteered to do this and designed a curriculum for these girls to show them that healthcare was really an ecosystem. It's not necessarily just doctors and nurses and clinicians.
It makes you perceive healthcare differently because you think healthcare is going to be at the doctor's office or just dealing with money, but you actually do stuff to help your community.
It was totally an experiential learning thing for them. It was actually interesting. During one of the sessions at our site, we had a blind person come in with somebody who was guiding her. And after we talked about that lesson, they saw it right outside in the hallway at our site. So that couldn't have been more perfect.
I mostly enjoyed the part where we got to visit a hospital under construction because I'm really interested in architecture and I wanted to kind of figure out how the system worked. We actually got to meet a lot of women that were part of that process, and one of them was the boss or the leader of it, and she was a woman too. So it was empowering to see that.
So one of the reasons I was super excited about having the SuperGirls with us is because most of the people right now who are practicing pediatric therapy are white. And we don't know exactly why that is, but what we do know is that it's important for our clinical staff to reflect the population we serve, and that leads to better outcomes for our kids, and it's the right thing to do.
Just having this fellowship for the first time here opened up a window of opportunity. Our pipeline before was whoever applied for a job. Now our pipeline starts in middle school. How does that work?
Every time we have a fellowship, I like it, but this one, everybody was saying there's a lot of work and stuff, but I know that's a lot of work, but at the same time, my mom always tells me that these are college graduates that get to do this, but you guys are 9 through 14 years old, and you get to do this and learn about this. And I think since you already knew the stuff when you were younger, it will be easier for you to do it when you're older.
Okay, so I'll tell you a little bit about our process. So it was a very packed month with lots of things. Our SuperGirls are very competitive people, and they were tasked with doing, and they'll let you tell them all about it, with making sure that they have a capstone presentation, and they were divided randomly into 2 groups by picking numbers out of a hat. And they have since decided that no one, including adults who know how to do things well, are as proficient as they are. And so they were tasked with selecting an issue that is facing women and girls in New Jersey, and to come up with a solution and to integrate what they've been learning on the capstone. And so we have 2 groups. Both have selected the issue of mental health, which who in here from RWJ work on issues of mental health, right? Yeah. That's our rotation yesterday. The way he saved people's lives, you don't know that. So the first presentation is from a group, and I have to play their theme song in order for them to enter the room. So please let me enter.
Hi everyone.
Hello.
Our group is called the Healthcare Heroes. I'm Hunter. This is Zora. Amina, Simone, and Nora. Today you're going to see our presentation, and within our presentation we will have a skit, and then following our presentation there will be some great information. Over the course of 4 weeks we visited different RWJBarnabas health locations and hospitals, and overall it was really fun, and I think, and we all agree, that it was a great experience. And we hope you enjoy our presentation, and now Zora will tell you exactly what our presentation is about.
Hi, my name is Zora. We were asked to discuss and look at the problems we saw in the healthcare system towards women and girls. We chose mental health, and in our presentation, we discussed the strategies of addressing mental health and the problems we see in it. And now we will go into this.
Class, this is Juliet. Do you remember her? She was your friend. She just came back from a little visit to the mental health hospital. What is she crazy? Beth, the meet and greet.
Hey, we saw you in class today.
And we didn't say anything to you.
I'm sorry.
Beth left you were crazy.
Friends?
Sure.
Mental health affects women and girls everywhere. About 80% of women and children have mental health disorders. We need to create opportunities for these women and children in order to ensure success.
Respect! The problems in our skin. Number 1, being outed. Number 2, being isolated. Number 3, being too forgiving. Number 4, being a black girl with mental illness.
So, teach the care circle. Recommendation number 1. Our recommendation to avoid the problems we saw in our skit is teaching the care circle. Caregivers and teachers need to support to avoid the following: shaming, outing, avoiding, and denying. 47.5% of mental health patients don't feel supported. That is really close to 50%. That is a huge amount of people who don't feel supported, and it's really important that, especially if you had something happen, that you need to feel support in order to feel better. So we recommend that there are training programs by RWJBarnabas to help the teachers and the caregivers know and better understand how to support others.
Recommendation number 2, teach the friend circle. The problem we see in this slide is 30% of mental health patients do not feel welcome by friends, and 70% refuse to comment about being hospitalized. Our recommendation is that RWJBarnabas seminars for community members in New Jersey schools, and it teaches kids how to support mental health patients with these disorders. Recommendation number 3, ensuring patients feel confident to return to everyday life. The problem on this slide is, well, first of all, Juliet forgave the girls too fast when given a quick sorry and told she was crazy. 70% of mental health patients do not feel confident after an episode. So our solution to that is to create a program that supports mental health patients after they leave the hospital. This program works to boost their confidence and teach them about healthy relationships.
And our last recommendation that we had was to support Black women and girls, because we saw a major problem that was with Black women and girls in healthcare. We saw that only 25% of Black Americans seek
mental health care, which is about 1/4 of the whole population. And Black Americans are less likely to be accurately diagnosed. So for example, a person with schizophrenia might be diagnosed with depression. And that's a real problem when it comes to medication and doctors, and it just creates a series of a ripple. And very few Black American mental health workers. There's only 2% of psychiatrists are Black, 2% of psychologists are Black, and 4% of social workers are Black. And that's a real problem. And so our solution to that was to destigmatize mental illness in Black communities by training more Black Americans to become medical workers, which our healthcare program actually helps with that, and to teach business owners and employees about myths surrounding mental health, so then they know how to treat Black Americans, and they know all the myths and not to inaccurately diagnose people or to know the symptoms.
Lastly, we would like to thank RWJBarnabas so much for letting us present to you. We hope you consider and keep in mind our presentation for the future of healthcare.
They're so wonderful. So they put together their words, their scripts, their ideas, and all of the pieces. And Lisa Inekwe, who is Amina's mom, she makes presentations for a living. And yet, she was not allowed to be a part of the process. And therefore not a part of the process even for the other group. So I want to now welcome you, the second group, to offer their thoughts and ideas about what RWJBarnabas and healthcare needs. Welcome.
Hello everyone. We are so honored to be here today to share with you our ideas. Our assignment was to discuss an important issue facing women and girls in New Jersey and propose a solution. We were also asked to incorporate what we learned at the Healthcare Fellows into this presentation. But before I begin, please let me introduce you to our wonderful group.
My name is Tori Fergus, and I'm going into the 8th grade.
My name is Brianna Leach, and I'm going into the 8th grade.
My name is Nima Wood, and I'm going to the 5th grade.
My name is Olivia Raymond, and I'm going to 6th grade.
And my name is Ariane White, and I'm going into the 5th grade.
And I am Riley Dias, and I'm going into the 8th grade. Our project focuses on depression and anxiety because it's an issue that does not get a lot of attention. My group and I stand here today to present a solution to this issue. We believe our organization, Greenbow, and the services it provides are one solution to addressing issues related to depression and anxiety for women and girls.
Greenbow is a nonprofit organization that provides resources to women and girls who suffer from depression and anxiety. Our organization's mission is to destigmatize depression and anxiety.
We believe that we would be an ideal partner for RWJBarnabas' programs on mental health, and especially those that focus on women and girls from ages 6 to 18.
When thinking about depression and anxiety, this quote from J.K. Rowling, author of the Harry Potter series, really helped us understand what it is like to live with depression and anxiety. The quote says,
It's difficult to describe depression to someone who's never been there, because it's not sadness. I know sadness. Sadness is to cry and to feel, but it's that cold absence of feeling, that really hollowed out feeling.
Why we chose this work. Our research on depression and anxiety found a variety of interesting and saddening facts. Here are some of them. Approximately 12 million women in the United States experience clinical depression each year. But we do know that this number is not and will never be completely correct because depression in women is often misdiagnosed 31 to 50% of the time.
About 1 in 8 women can expect to develop clinical depression during their lifetime.
sadly, women experience depression at roughly twice the rate of men.
Girls 14 to 18 years of age have higher rates of depression than boys in the same age group.
About 8% of teens from ages 13 to 18 have an anxiety disorder with symptoms starting around age 6.
Depression in women of color. Though mental illness is common, it is also stigmatized. Unfortunately, African American women are often stigmatized for being depressed. As a common misconception is that since many African American ancestors made it through slavery, black women can make it through anything. Black women who suffer from depression are seen as weak. Women are often often asked to take this problem to God instead of seeking professional help.
Despite high rates of depression, Black women receive low rates of treatment.
About our logo. After learning about what depression and anxiety means for communities of color and women, we decided that something can and must be done. We chose green bow as a symbol of the green ribbon, which represents mental health awareness and adds a feminine twist. Our logo also has a circle, which represents our community circle. We use the color green to represent the GrassROOTS Community Foundation.
So now you ask, how does Greenbow actually work? Well, our organization works in two ways. We have a digital and physical method of work. We developed two sets of approaches that allow people to be met where they are. Our first is a digital app called Breathe OK that allows for people to share information privately. And the second is a physical and boots-on-the-ground method in schools for more community engagement.
Digital curative care. Given the high rates of stigmatization, we've developed a free app, Breathe OK, which allows those who may have depression and anxiety to anonymously engage with those who can provide support to them. Through the app, individuals can ask questions to therapists from RWJBarnabas. Also, they can receive alerts from the available RWJBarnabas counseling or community events.
This app provides a handy mobile tool for people on the go. It also gives people access to strategies, methods, and tips that can help reduce incidences of depression and anxiety. The app also allows people to connect through reading and sharing other successes, and it also provides a way to anonymously report anything hurting them without having to share their identity.
A mock-up of Breathe OK. A mock-up of Breathe OK. For our app, we wanted it to be similar to an app called Guidebook, where information is easily presented and the space is user-friendly. There are 5 components of the app: contact us, local events, helpful methods, stories, and emergencies.
For people who don't feel comfortable or just don't have access to online resources, we will also have bi-yearly assemblies in elementary schools all throughout New Jersey. Working with teachers and student leaders, the assemblies would provide students and educators with the information to detect depression and anxiety for children grades K through 6. Our goal is to normalize the conversation about depression and anxiety in the way that we have about autism.
We would also like to work with educators to infuse more lessons in the health curriculum for 7th, 8th, and high school students. We believe the focus should be on providing real-life stories and relatable lessons. We also seek to host a series of community events that will provide awareness of depression and anxiety.
Green Ribbon Week. Green Ribbon Week is a critical part of our work for making sure that individuals everywhere understand that depression and anxiety affects all of us. To end the disgracing, we would like to create Green Ribbon Week. Green Ribbon Week is a week dedicated to bringing awareness about anxiety and depression to people around the globe. Green Ribbon Week would be celebrated during the second week in September. We would also like this event to be adopted by RWJBarnabas, as it is the largest delivery healthcare system in New Jersey. We believe that RWJBarnabas has the resources and network to make this possible. Greenbow is one step in aiming to address the lack of non-stigmatizing resources available to women and girls living with depression and anxiety. Through our efforts, we believe that we can, 1, help women and girls find safe, reliable resources to get help, 2, end stigmatizing of these health issues, and 3, engage and educate communities about depression and anxiety. What we learned. Newark Beth Israel's Wellness Center. While at the Newark Beth Israel's Wellness Center, we learned that having a strong sense of community and collaboration allows for people to come back and use their services. Because of this, we would like the Green Ribbon organization to have an open environment.
Qualitas Pharmacy Services. Taking many medications for mental health may be difficult and not be covered by insurance. Children's Specialized Hospital. Care that requires therapies are often stigmatized and not used because society treats those patients as if they're weird or crazy.
ITNS. Reporting what may make you feel sick or ill is really hard to share and takes a lot of time.
We want to give a big thanks to the RWJBarnabas Hub for teaching us about what it is like to work in the healthcare system. We know without this partnership, we probably would have never had this big opportunity, this hands-on experience at such a young age. Yes.
Thank you.
Thank you.
SuperGirls come have a seat. Weren't they amazing? Yes. We had some special guests join us in the middle of the presentation. Mr. Barry, please meet our SuperGirls.
I just started to pack my stuff up in my office. I assume one of you will be CEO. Sorry. Hey, how are you? Good to see you again. Good to see you. That was fabulous, really. You know, Micheline has told me a lot about this project, and it is incredible for me to meet the future leaders of our country, thank God. We certainly are in need of that. And your enthusiasm and intelligence and personalities are what's going to make you successful. And frankly, those of us who look for leaders, those who want to be led, as I certainly do, by people who have those attributes, I just can't wait. Now the question is, how do we keep you involved with RWJBarnabas Health? I assume none of you are doctors yet, right? We can fix that also if you're interested. But we now and you now are part of the family. We are always here to help and support and encourage. And I hope you do take advantage of your new family status with us. And I'm going to personally ask people to keep me informed as to how you're doing. And while we always experience and expect success, I think your presentation was a good one to remember that sometimes on the road to success, people don't feel as well as they could feel. And that's the time, I think, when an organization like ours can be most meaningful. So whether it's a big program or project, or whether it's the individual support that each of you deserve, I would hope that you never need that, but if you do, I wouldn't want you to forget the contribution that you've made to us so that we can reciprocate and we can pay it back by supporting you as you pursue your lives and careers. So congratulations. I didn't mean to be rude to walk in the middle of it, but I certainly heard great stuff, and I look forward to meeting you over the years individually and hearing about your great success and happy lives. So thank you very much.
So I'm sure you all have questions, especially those of you who've had an opportunity to experience the girls. So they are here for you to ask your questions, and happy to answer them, whether it's about things that they've learned, recommendations that they have, etc. As you can see, they have very strong recommendations about what they think should be happening in health and healthcare. So please feel free to pose them a question. They are ready and willing to answer any questions.
Why did you guys choose behavioral health?
For us, well, there's a couple of reasons, but the reason we chose it is actually it's kind of complicated, but I saw a video about mental health online, and I thought it was cool because it was talking about it as like an invisible injury that a lot of kids, they don't know how to describe it, they don't have the words to say that something's happening, and we started to think about it more, and we thought that our other group was doing a different project, so we thought that it would be a good idea. Then we ended up doing the same thing, but we thought it would be interesting to talk about something that in our schools is pretty taboo to talk about, and also the research that you all gave us kind of led us to think about something that was different than what we actually might have learned at the fellows, but to combine all of it to think about a new topic.
My group, we picked it because we thought that, like, a lot of times people don't think of like anxiety and depression and other things that other mental health sicknesses. People don't think of them as mental health sicknesses. They just think of them having children or like black women and girls just being like sad or nervous.
Your group mentioned that there are very few black women or men, black people in the health services, so a social worker, psychologists, and therapists. I wonder if you had any indication as to why that might be, or how folks in those fields are employed and hired?
Actually, I researched that, and it was because they were afraid of discrimination and not being thought of as not being able to do different things, so they just don't apply.
From our group, at least Tori said it, is that the reason why there is a lot of misdiagnosis is that a lot of black women are told to take their problems to God, and that they're not just told to seek professional help. So if you grow up not believing that you need to go to the doctor to fix your problems, that you can pray for that, then you're not going to probably want to pursue that career, because it is a common thing for a lot of black families as well.
So if you were going to pick a healthcare career today, if you're going to commit to something, I want to hear from a few of you, based on what you saw, what would it be?
I liked government affairs when we got to meet the assemblywoman company.
I like marketing.
Yeah.
Yes. I like the Children's Specialized Hospital.
Good answer.
I like pharmaceutical.
Lots of good choices.
I really like the radiology department.
I like pharmacology.
I like the Children's Specialized Hospital.
I like the pharmaceutical.
All across pharmacy services.
Pharmacy is a great career, right? Okay, so when you're ready for a job, you know you're going to just call all of us, right? We'll put your resume on top.
First, I want to say that you all are phenomenal, and these presentations were just outstanding. So thank you for sharing them with us and for the time you put into putting them together. But I wanted to ask, I spent time with a lot of you in the marketing rotation, but I'm wondering if through your other experiences, there was anything that you were surprised about that you didn't realize before you got here was part of a healthcare environment.
Yesterday we went to Hamilton and we got to go to the cancer center, and I didn't know, we actually got to meet with the social worker, and we learned about the history of social work, and I didn't know that I didn't know what the Children's Aid Society was, I didn't know how old it was, so I thought that was interesting that I didn't realize that it actually wasn't for a long time that there were rights that actually protected children from working and going to school. And I remember Ariel's face when they said that kids could work 14 hours a day. Ariel was like, oh no. But I enjoyed that a lot.
Well, one thing that surprised me, I had kind of gotten confused about it, but on Tuesday, I think?
Yeah.
Tuesday, we went and talked to an assemblywoman, and she said that there were only 2 people in government affairs, in the government affairs department. And I thought that was really crazy because it seemed like a very important job that more people
Also, when we talked to the assemblywoman, she said her job as an assemblywoman was a part-time job, not a full-time job. But that they didn't pay that much. It was like $49,000.
Was there anything that you learned about the healthcare system? So, for example, the first day you came back, one of the things that you talked about was remember the big day in the room, hearing from all these people, that many people did not start off in healthcare.
Yeah, one lady we met at HR, she started off with like a religion major and like a minor in like psychology and music or French literature or something. It was interesting, but at Qualitas, I was surprised that like a lot of the people there, most of the jobs were actually about people getting paid, like people giving the money through the insurance companies and people making sure that they paid the same amount for their anti-rejection medicines. And there wasn't actually a lot about giving people a super amount of care. And I know that that's still their job, but it was kind of surprising to me that the main focus was making sure that all this money, the people, no matter what was going to happen, that they had paid a certain amount over the course of time. It was kind of surprising, but I honestly wasn't that surprised because it's a huge industry where a lot of people need that, so they're going to focus on what helps that industry.
Nothing else?
No.
How many black men did you guys have a chance to work with on the?
One construction guy.
Oh, yeah,
Right
the
there.
construction does it.
That's it.
Did that surprise you or not surprise you?
I didn't notice.
I didn't
Until you
notice.
said it.
Yeah, I didn't
notice.
They were all
Yeah.
It didn't surprise me because we were working with like just a group of women. So, yeah.
Are there any additional questions?
I believe I have a question. I remember with the green bow, was that an actual app that you guys want to design? So how does that work? Because I wasn't really sure.
Well, we didn't actually get to design the app.
Okay,
We didn't-
too early,
we-
okay.
Yeah, but we just basically tried to create like what it would look like if it was a screenshot. And if you've seen the app guidebook, we wanted it to look similar to that, but we didn't have that technology skills really. It's too complicated. So we just kind of came up with that. But for the logo, we thought that at first we were looking up like symbols that represented mental health. And then we saw a green ribbon, and then we thought about like also Red Ribbon Week, which we have in our schools, where like you wear a ribbon, you get a bow at the nurse's office, and then you like saying, I'm against drug abuse, I don't believe in this and this. And we were like, why don't we do that for mental health? Because it was kind of a cool idea. It was actually Tori's idea. And now we have our ribbons, but then the bow, because it kind of represented being a woman and women and girls, and that looked cute. So.
Let me know when I can download them. Okay.
Ladies, I'm having this phenomenal experience working with this organization. School's starting in another month or so. How are you going to take this experience and then go and evangelize this message throughout the school, to kind of change the mindset that, healthcare is a viable industry to pursue?
In our presentation, we said that we would like to have Green Ribbon Week during the second week of September, and we actually want that to happen, so there will be depression and anxiety awareness. And the reason why we want to have it in September is at first we wanted to have it in August because there's not many like holidays or anything in August, but then we thought it should be in September so that schools can celebrate.
I think I could do my own personal Green Ribbon Week. I mean, Amina and I go to school together, so if we wanted to start that, I think that would definitely be a huge thing. Because at our school, there was a kid who said he was going to commit suicide, and then he got expelled from our school. And there's a lot of conversations where they try to shut down mental health. So I think that would be a huge thing that we could contribute as we're older next year.
And then also letting other people know that there are so many opportunities in healthcare. It doesn't always have to be a doctor or nurse. That there's so many avenues to pursue. Good job, ladies.
Before today and before this healthcare fellowship, had you considered healthcare as a potential pathway? And how many of you changed your minds before you came in? Were you thinking of other career pathways? So, yeah.
Well, before this fellowship, I did not like hospitals. I did not want to be a surgeon. It just freaked me out. I was really scared of all that blood and stuff. And when we got here, I was really nervous because I was like, I don't know if I can do this. It seems like it's going to scare me. But I realized that there are a lot of fun things that you can do in healthcare that you don't have to be a doctor or a nurse and things like that. So maybe I would want to work like in building hospitals, like I said in the video and stuff like that.
Okay.
For me personally, like I was thinking about when I got older, being a surgeon or like a doctor or something like that. But then because when I was coming in, I was thinking we're probably going to need like a bunch of doctors and nurses and stuff. But this really opened my eyes to like all the different areas of healthcare because I didn't really know that there was government affairs, all this other things going on.
Any additional questions? Okay, all right. I can end my Facebook Live. So, I personally want to extend a super huge thank you to the Women's Leadership Alliance for selecting us to be a part of this work. It is really, I am half crazy. I think everyone knows that, right? And a part of being crazy is being crazy enough to think that women and girls are worth the investment of our time and our energy. And I really respect RWJBarnabas for matching my crazy. They're like, we see you're crazy, let's do it. And so the Women's Leadership Alliance within RWJBarnabas has really stepped forward to say, let's up the ante and make this possible. We hope to continue doing this work. We know that so many of you gave up your time. We know that you had to cajole people in your different departments. We know that you had to reorganize your own personal lives to make this possible. And we are grateful for your investment in girls and investment in the GrassROOTS Community Foundation. I know Atia is a liaison to the Women's Leadership Alliance. And so I want to say to you, I want to say to Barbara, Micheline, and the entire crew who has lifted us up. Thank you, and thank you.
Thank you.
So we have one more part. We were really excited to take on this piece of the WLA. Community engagement is one that's near and dear to RWJBarnabas Health. And so on behalf of our president and CEO, Barry Ostrowski, and our infamous fearless leader, Micheline Davis, and the WLA, we'd like to present all of the girls with certificates of completion because, you know, you guys really put in the work and we are so very proud of you, and you need to take something back that says that you were definitely here and you definitely made a difference.
So I'm going to call your names and you can come up and get your certificate. And then this is a great photo op too. Amina? Marley.
I'm proud of you.
Tori. Hunter. Brianna.